Hello, good afternoon to all for those who are attending from the Europe and the UK, and good evening to all for those who have attended from the Asia Pacific. I am Dr. Rajiv Maharjan. I'm currently working as an additional professor at the BP Kodla Institute of Health Sciences, Dharan, Nepal. I would like to thank the editor and the family Journal of Orthopedics family and for this privilege and also the previous speakers who have made my job easier. I am here to encourage the future potential reviewers. As soon as you get the invitation via mail, there is a link for accepting as well as to decline, or you may directly log on to the editorial manager of the system. You will have an abstract, and you have to consider whether you are going to accept the invitation or not. Few of the important things like whether you have the expertise is needed, whether you have expertise or not, it is needed for high quality and timely judgment. The reviewer may be having a conflict of interest, which may be with the same procedure, with the device or drug used in the study, or the reviewer might have published, collaborated, or worked in the same place with the author. The other important thing is the time, which is of vital importance. And if you don't have a time, please don't waste time of the others because it delays the publication process and is a matter of frustration for the author as well as the editor. So it is just like applying a break for advancement of the science and the author's contribution. The other thing to be considered is ethics. It is highly maintained as the article is a privileged confidential document. The, the confidentiality is to be maintained and advising an author for to cite the reviewer's own article just to increase the number of citations is not a good idea. Now, regarding the acceptance, you can log in to the editorial manager. You'll have all this pending assignment list. You'll have you can see the view submission. And now, the first to consider is whether the study is a finer. Finer means that is feasible, it must be interesting, it should be novel, ethical, and relevant. A problem well stated is problem half solved. We must be unbiased towards the name, institute, and country, religion, gender, etc. Because high quality paper can be from a developed country as well, because nowadays science is everywhere. The reviewer is usually not rigid, but it may not be rude also. The reviewer is an unforeseen supervisor of the author. Until unless there is a gross mistake with the methodology or plagiarism, the reviewers are usually not rude. The language and the audience, regarding the language and the audience, English must be reasonably well, and it is clear and simple, and it should match the standard of the journal. And the audience should be thinking whether the audience should be a global so that it is highly rated and cited and read by the most by the audience. We must, in the first pass assessment, we must see whether the journal requirements is and the author instructions are followed or not, and to see if the number of authors they satisfy the international committee of the medical joint editors, medical journal editors, the standards guideline and the checklist like council for the RCT, stroke for the observational studies, Prisma for the system review and meta-analysis, and Arrive for the animal studies are followed or not. And the other thing is, it is the duty of the author to get the ethical approval, maybe in the local, maybe in the national or international level, and the registry of the trial as well as system review and the meta-analysis. In the second pass review, the title should be usually in the form of PICO or PICO. That is the population, intervention, the comparison, the outcome, the study design, as well as time frame. Or it may be in the form of like a spider, that is sample, phenomenon of interest, design, evaluation, and the research type. It may be like a SPICE form, like the setting, perspective, intervention of interest, comparison, and the evaluation. The abstract is usually must be clear, it must be inclusive and short and consistent. And while giving the keywords, it should be from the medical subject headings. In the introduction, the study must mention the specific lacune in the literatures, the rationale of the study, and the study hypothesis is available. The study must give the audience a new message, and the outcome tool used must be predefined. They must be practical, objective, and the standard, and issues of the copyright has to be solved, if any. In the material and methods, this should be a comprehensive and explanatory so that it should be reproducible. Whatever the instrument and the implant, the instrument and the devices or agents have been used, they have to be calibrated and identified. The informed consent of the patient is mandatory. There must be inclusion and exclusion criteria, and the method of recruitment, randomization, allocation, and data extraction must be clearly mentioned in the method and methods. Every attempt has to be made to eliminate the bias and the errors and the confounding factors. Regarding the statistics, there must be adequate power study and sample size calculation, and level of significance must be fixed before the study. And the software used for analysis and its version has to be mentioned. There are some common statistical errors like wrong sampling methods, the loss to follow-up, the inappropriate test use or data normality not being checked, the presence of the outliers. There may be a use of wrong numerator and denominator, or p-value has not been specified like that. In the results, there must be no or minimal repetition of the data. Of course, the data verification will be easier if available online. Otherwise, there is a situation of garbage in and garbage out. At times, there may be a supplementary files and data associated with the article. And every attempt has to be made to take the consent of the patient and whether it's at the copyright issues regarding the data. In the results, the graphical representation is better because it's eye-catching. The quality, the format, the size, the appropriate position, the aspect ratio, the originality and identity of the patient, it has to be considered while presenting data in the graphics mode. In the figures and tables, it must explain the results and clearly define the protected parameters. If you are using a table, then there must be optimal columns and rows, and the data must be with their proper units. And of course, there must be a self-explanatory headings. The figures, there has to be a self-explanatory or explanatory with the legends. The chart should be having a contrasting pattern of color, title, values, and the legends. In the discussion, it must be explained well and with correct interpretation. This must be with a well-balanced and a critical analysis, and it should give a future research perspective or real-life applications, if any. The strength and the weaknesses of the study has to be mentioned with or without the modification from the reviewer. The conclusion is simply an exact, short, and clear take-home message, and it should be in line with the hypothesis. Regarding references, it should meet the journal requirement. If the online sources has been cited, there must be a mentioning of the site and the date access. The text referred must be cited and vice versa. However, there are bound to some errors, like there may be some less relevant fillers like references just to increase the number of citation. There may be a reference of the references as I mentioned. There may be unbalanced citation like new versus old or for versus against, like that. Of course, there may be a self-citation by the author itself regarding of his own study. At times, the reviewer might recommend to cite his or own study just to increase the number of citation. Of course, how to submit and the process of submitting will be did by the next speaker. But in our Untitled Manager, there is an option to see the submit recommendation. And there you have to provide your recommendation and this logistic regarding transfer authorizations. And there must be a secret confidential comment to the editor as well as a comment to the author. And you must finally upload all these things online. Thanks for hearing. Thank you.